Hello, my dear friends. The guest we have today is an amazing person. He is a cosmetic dentist, a clinician, a lecturer, has a thriving practice in Dubai. Adding cherry on the top of cake, he is pianist as well. He is examiner at Royal College of Surgeons, Edinburgh, UK. He believes sharing knowledge and his mistakes is what he loves the most about lecturing. To be able to motivate young dentists to work harder and smarter makes him work even more harder. The mistakes he has made in his life, he makes sure no one else does. The problem he has faced should not be faced by others. He is very famous and has a great following on Instagram where he posts not because there is a freedom to post in anything and everything. His posts are like well drafted, flawless posts full of good, flawless pictures, amazing and meaningful write up, beautiful quotes, and meaningful hashtags. Do not believe my introduction? Then why don't you go and witness yourself? A link in the video description. Welcome Dr. Ritul Agarwal to Wise Dentist Success Talks with Dr. Ravi.
Thank you so much, Ravi. Thank you so much for inviting me. I hope I am able to do justice to the time that you have given me.
So, Doc, my audience is thrilled to hear you sharing your success story on Wise Dentist Success Talks with Dr. Ravi. Thank you for promptly saying yes and helping us record your wisdom and sharing it to world.
Awesome. Let's do it.
Okay. So I'll pop on my first question. If you could tell us what is the degree MProsthoRCS Edinburgh and FDSRCS Edinburgh. I hope I've spelled it right.
Yes, yeah, you have pronounced it perfectly all right. So basically, this is a degree that you get after giving the membership examination after your master's. So it is not a degree that any general dentist can give, unfortunately. So for general dentists, there is MFDS that you can give. So MFDS is an exam for general dentist, whereas each specialty has got their own exam to be given after their master's. So I gave my exam in 2011 in Cairo, and then that was the membership examination, in which out of 14, I think 3 cleared when I gave that exam. And then in 2011, when I appeared for that exam, I cleared it. In 2017, I got my fellowship. So for getting the fellowship, once you wait 5 years after your membership exam, you can show your success, your kind of progress, not success, but your progress in 5 years. And they can give you an FDS without assessment. So my FDS came without assessment based on whatever I did in 5 years, courses, conferences, whatever it was. And then after the FDS, there was an opening for an examiner. I applied for it and I got selected. So in 2018, I became the examiner for this exam. 2019, I examined once, and then COVID happened. Unfortunately, the exam stopped. So probably next year or this year end, I might examine again. So that's the membership exam.
Wow, that's amazing. So, yes. Doc, if you could tell us, how did the Royal College of Edinburgh thing happen? Are you the first one from India to have achieved this, and how do you see this?
So, I mean, I don't know if I'm the first person giving, probably this exam given from India by an Indian dentist immediately after master's. Yes, maybe, I don't know. There might be people who have given it. I didn't know anybody when I gave that exam. So I tried to look for people to help me out, but there was none, unfortunately. And so my guide was pushing me, and she was like really nice. She is really nice. And she pushed me at that time that, Ritul, you can give that exam. I always wanted to give that exam, and then maybe you can give it. And the time when I gave it, we were supposed to present 4 cases of ours. Okay. And because she was so punctual about taking records, I had those 4 cases ready with me when we decided to appear for that exam. Now the case thing has been removed from the exam, component. So you don't have to submit any cases. So I had 4 cases. I went and I gave that exam. I was lucky enough to clear at the first attempt. So yeah, so that's how it happened.
Lucky enough, and definitely hardworking, and hard work pays. All I can.
I don't know about that. I was lucky, I can say for sure.
Okay, that's
hardworking. I'm not that hardworking.
Okay, but looking at your work, looking at your profile, that's all we conclude that yes, you are hardworking.
I'm passionate about what I do. Hardworking, no.
Okay. Amazing. I move on to my next question. Let's get a nostalgic from inspiring young dentists. Please share your journey from UG to PG in Manipal and then Dubai. How did you work towards your dream?
All right. First of all, my dream was never to move to Dubai. I'll be very, clear about it. It just happened. Okay. So why? I mean, I finished my undergraduate in 2006. 2007, my internship got over. So my hair just looks old. I'm not that old, by the way. 2007, I finished my undergraduate. Then I did my master's from Savita University in Chennai.
Okay.
So that was from 2008 to 11. And then 11, I gave that exam I was talking about before. And after that exam, my aunt was working here in Dubai. Not my aunt, my mom's friend. Okay. She's a gynecologist. So she said, why not you try for this place? I sent my CV. Luckily, after that exam, I got an interview from the government directly. And so I worked in the DHA here for 4 years as a dentist. But then I left that job in 2016. But yeah, so I got called for an interview, gave the interview, got selected, and came to Dubai. At that time, what I was earning in India and what I was getting in Dubai, the difference was quite stark. And plus, I mean, it was always a risk that I wanted to take. So I took it. It's been there since 9 years now. So yeah, that's how it happened.
Okay, that's amazing. So as we all know, like right there in India, we look upon practice in Dubai as an achievement. So let's talk a bit about this. My first question, how did the idea of starting practice and then workshops as well in Dubai happen?
So, I mean, I'm not doing my own practice. So I work for a corporate. I work for a corporate group called MediClinic here. Right now I'm working in their center that is located in the Dubai Mall. So, I mean, now the tourist visa is open, and if anybody who's watching would want to come to Dubai, would visit Dubai Mall for sure, can just drop me a text and I'll be more than happy to meet them.
Oh, wow.
So anyways, I mean, I worked there now since past 3 years in Dubai Mall. And then I went to attend the course of Ghalib Gurel. So in 2019, I think 19, yes. 2019 in April or March, I went to attend in Istanbul the course of Ghalib Gurel, the veneer course. And when I came back, I had no idea of that I'll be teaching or I'll be, taking up courses. So one colleague of mine approached me. He said, do you want to start a course of your own? So I said, all right, why not give it a try? And my mom was always after me, like from the beginning, that you have to be a speaker, so it's something behind in the head that is always talking to me, right? So I said, all right, why not give it a try? And then my first course happened. Worked hard for it. I mean, creating a course is the most difficult part. And then my course is generally, I'm the only person who does it. So like I talk for 9 hours on one day, and then the second day it's 9-hour hands-on workshop. So it's a 2-day veneer course that I, as a whole, take alone completely. Of course, there are people to help me out. There's a company that helps me out in Dubai with the materials and everything. So they provide everything. And then, I do the courses here. And then once I did one course, then 2020 happened, COVID happened, the webinar series started. So then everybody was like, yeah, webinar. So I did some couple of webinars, and then again from one to other, and then some people are inviting me. Some people I went personally and said, because of course I want to grow myself on Instagram. So again, it's a slow process of growth. That 12,000 followers, what you see on Instagram is 1 year of hard work that goes into it. It's not like anything is bought, or, I mean, of course I've spent some money on marketing, but then it is all very genuine money spent. So it's not like it's a growth that I'm proud of, actually.
Wow. Yeah, seriously. I mean, we can really vouch upon looking at your cases and the kind of post you put into. And each and every post is not just a post. I mean, there is a good context, very good write-up. All I've seen
that she writes for me. My writing bit, I mean, Gayatri does it. So most of the writing bit, Gayatri does it. Sometimes I do it. So the ones that are like grammatically very correct are done by her. The ones that would have some faults, I am the person writing those.
Oh, that's amazing. That's amazing to know that your better half is absolutely, absolutely gelling in your profession. That's amazing.
Yeah. She's an orthodontist. Of course, she knows it. And so, I mean, her English is better than mine. I'll agree to that as well. So she writes for me sometimes. Yeah.
Okay. Yeah, but we can for sure make out from your post. Your each and every post, I must really confess, not that because I'm interviewing you. Your each and every post is very well scripted. I find very beautiful use of words out there. Everything is arranged as if we are, we say we are an artist. We take everything seriously. It's amazing.
Awesome.
Okay.
Thank you.
So, pleasure. My next question: how is the practice in Dubai and India different?
I mean, this is a question very difficult to ask, because eventually this will go on to a question where how much you earn or how much is an average salary in Dubai. And I mean, see, it's again, if I say that things are saturated, they are not that good as what they were probably 10 years back, people will think, you know, khud to baitha hua hai, and then he's like telling us not to come. So again, I mean, it's a struggle. It's a struggle for a people. People forget that there is a struggle phase. They will look at the golden part about it, which is not exactly true almost every time. You have to work hard. There will be jobs that you will not be really happy to do, but you learn something out of it. Like my government job was fantastic. I learned a lot of general dentistry, which I didn't do when I was doing my master's. So that helped me. But then there were problems that were there in that. I mean, I decided to leave it. I decided because I wanted to grow in my career a little bit more. So, I mean, the journey is always difficult. So it's not like you come to Dubai, you start making millions, you start making dirhams, and you're like, wow, and then, you know, life is good. It doesn't happen. I mean, it's still a struggle. Every day when you get up in the morning, it's a struggle to go to work. It's a struggle to work. It's a struggle to convince the patient, struggle to keep them happy. So it's not easy. But I mean, it depends on what kind of job you land up into. I mean, if you're lucky, if you're at the right place at the right time, why not? I mean, but it's not like it's very easy. So getting the license is very easy. I mean, which is the eligibility letter. So exam is very easy. It's not difficult. I don't know why people take coaching for that. I don't know why people spend money to do it. It's a fairly simple exam. That's what I've heard. I've never given that exam, so I'm nobody to say that. But from the things that I've heard, it's not a difficult exam. So getting the eligibility letter is not difficult, but getting a job becomes difficult. And then there is depression setting in, then there is frustration setting in when you can't get something. So when you decide to move to UAE, you should have a very solid reason to move to UAE. And second, I mean, you need to be patient. It will take probably months to few years for you to kind of get something what you really want. So of course, it's a nice place to be in. I mean, I will not say it's a bad place to be in. I am what I am because of I am here. But generally, it's not a very easy, you know, a bed of roses. One or two roses in a bed of thorns, right? So you have to just pick up those roses. That's all.
Amazing. A very good perception to narrate about. Okay, so if you could tell us in short about the process of practice in Dubai, or coming to Dubai and practicing in short.
So again, it depends on a specialty or a general dentist. Each have got their own experience requirements. Again, they keep changing. So I would recommend you to go to the DHA site and look for the amount of time that you need to work before you can apply for a license here. I think for a general dentist, it is 2 years. For a specialist, it is 3 years after their degrees to come and work as a dentist here. Okay. Again, general dentists, I'm sorry, but it is not that great. It is all revenue sharing now mainly. So, but I mean, of course, if you decide to come in, I'm more than happy to help you out in whatever way possible. Don't ask me about the DHA exam. I have never given it. So, but I can tell you it's not a difficult exam. That much I can tell you. The questions are a little confusing. It's like for a sandwich, what you need: bread, butter, cucumber, and tomato, right? So you need all of them to make a sandwich, but without the bread, you cannot make it, right? So the questions are like that. So you'll have to be just fast enough to answer whatever you think is the right answer. Don't waste a lot of time. I mean, that is an advice I give to everybody for whatever exam you are going to. Like I recently gave the LDS exam, which is the licensing for the UK part 1. I gave it. So it's a 3-hour exam and you get around 90 questions, which are like really long. Oh. So if you ever plan to give an LDS exam, each question is almost 1 page long, right? Okay. So your reading speed has to be like really fast if you want to finish those questions in 3 hours. So your reading speed has to be fast. And I made a point that in 90 minutes, I have to be out. So if it is 90 questions, 90 minutes, that's all. So even if you're going for an MCQ exam of DHA, it's 70 questions. Don't spend more than 50 minutes in the exam. I mean, always whenever you are answering an MCQ exam, you should never sit for the whole time. Okay. Because the moment you sit for more, you will start evaluating your answers. You will again change them and it eventually ends up in a mistake. So it's not a difficult exam. You can always give it. For specialty, there is a specialty exam. For general dentistry, there is a general dentistry exam. All of them are prometric, 70 MCQs. If you will not clear in one attempt, for the second, you will almost 100% clear it. Okay, so it's not like the end of the world. So you can always give 1 attempt or 2 attempts, clear it. Clearing is not a problem again. finding a job is a problem. So you'll have to be in this place, probably spend some time, look for a job. You might not still get it, but it depends. I mean, it's a very situational thing. I mean, I don't want to demotivate anybody that ways. It's a fantastic place to be in, close to India. I mean, good lifestyle that ways, but you need money to survive. So if you are not getting good money, nothing is good. So, I mean, I'm not saying that you need to start earning 50,000 dirhams initially. You will probably never earn that amount of money as a dentist in Dubai, but at least 10, 12, you should be having that. If you're coming alone or with a family, you need to survive. So that's the thing.
Okay. Very well answered. Time and patience is what.
Patience, of course, you will need and you will need it even when you're working in this place.
Okay, so we move on to something motivational. As we all know, motivation is fuel. One needs to have constant motivation to ensure he or she achieves what he or she desires. So let's talk about motivation. What is motivation to you?
I mean, motivation to me would be, I will say, coming home every night and being able to sleep well. I mean, that's the biggest motivation. I would not want to end my day with something that I'm not really happy with. So I generally don't cut corners when I do work. If I'm not able to do something, I will refer to somebody if I think that I'm not good at it. So, I mean, mostly I've stopped doing extractions now. So it's a slow phase out of a couple of procedures that I don't do now. But motivation is all about keeping my patients happy, doing what I like, and spending time with my family. Family is my wife and my dog. And that's what it is as of now. That's what motivates me to be alive.
So who is the one who inspires you in dentistry and in personal life? Yes, you've said in personal life, your wife and your dog, but who in dentistry inspires you?
All right, so in dentistry, I mean, right from the day that I joined my college, all my faculty has been like really supportive. So it's a build up cumulative effect of the motivation that I get. It's not like I cannot name one person, it won't be the justice. But then it's a cumulative effect of how I was brought up by my parents. You know, they both are doctors. They work hard. They still work hard. I mean, they are like, I've never found, like, I never heard my father saying in the morning that I don't want to go to work. Same with my mother, even she's 70, she's 65 now, gynecologist. But till today in the morning when she gets up, she's like, you know, they will never be like, I've never heard them say that they're fed up with life or they don't want to work anymore or it's enough. So that is one, of course, that motivation is there. If you talk about family motivation, then there is professional motivation from my guide. She's been like awesome. So if you ever decide to do your master's from Savita, you can always take my name in front of Dr. Padma and she'll be like super happy. All right. So she's almost like my mother, part two. And I mean, she's the one who motivated me to do those exams, of course, without which, again, I don't think I'll be here. So I'll give that to credit to her for sure. And then, of course, I've attended courses and then there is general motivation happening from people around. So that's what it is. I mean,
okay, very nice to hear that. Definitely a part of motivation goes to your parents and definitely your guide. So I would for sure would want to meet her someday in order to, as you said, draw some motivation.
Oh, she's awesome. I mean, she's awesome. If you ever go to Savita in Chennai, I mean, you can just go and say hello. And if you take my name, she'll talk to you for hours.
Oh, wow. That's amazing to know.
Yeah.
Okay, Doc, I will move on to my next question.
Yes.
We are in an era where everybody is vouching on technology. Now, I read one of your posts saying that more brain you use, the less technology and materials you need. Can you please justify that?
I mean, see, the thing is, when we go to a conference these days, when we look at lectures, when we look at Instagram, I mean, of course, some people might be thinking, looking at my cases too, and I look at other people's cases and I feel jealous sometimes, right? It's a normal human tendency. I mean, the thing with technology is the more you invest into it, the more dependent you get onto it. And of course, there's nothing wrong with it. I mean, we are growing in a world of technology. So everything is getting better and better and better. But it all depends that you should not be burdened about not being able to have it. So if you're not able to have a scanner, you can still make a very good impression and still get a very good result. Probably it might be taking a little bit more time, little bit more effort, you know, you have to send it to a lab by courier or whatever it is. I mean, all that hassle is there. But then A scanner, I don't know what is the price in India, a scanner. How much is it called? Do you have any idea, Dr. Ravi?
Yeah, around 3.5, anything around 3.5 lakhs, approximately.
3.5 lakhs. Yeah. I mean, again, it's not a huge amount of money, but then it's still an investment, right? So if somebody who has invested a lot of money into undergraduation, then more money into post-graduation, we all know that the return of that investment is not that great in dentistry. At least in the beginning, it is not great. We all know that fact. Okay. And on top of that, when you listen to lectures, you listen to conferences, you see that people are having, you know, this fancy stuff, fancy gadgets, and they're using it and showing it off to you for whatever reason it might be. Then you get more pressured of not, you think that without this, you can't do good dentistry, but then that's not the case. So you should have good materials, of course. So I would recommend everybody to spend some money on materials for sure. So don't use cheap materials. Like don't start using cheap composites. Don't start using cheap impression materials. Don't start using cheap instruments. Everything affects the work that you do. Have a proper knowledge. I mean, theory wise, I used to teach in a college for a year. I know that theory is not that strong these days because for whatever the reason it is. Like in Manipal, the theory was strong. Okay, we used to be like really taught strong in theory. There in Savita as a college, we used to be like really pushed to our limits. So that ways, it was nice. Okay. So Dr. Deepan Nalaswamy came in towards the end when I was in the college. So he just came back from Canada and then we were in third year. So I'll tell you how we were taught the theory. I mean, he used to come every evening, final year PGs. He'll be like, come to the library. He'll get his can of Diet Coke, sit. And before that, he would say, today, 100 pages of Schellenberg, you have to read and come. And then he will just sit with a book and you have to keep telling page by page without having the book in your hand, what is there in the book. And the moment you stop or you're not able to tell what's written in the next page, you again go and sit in the library and read it. So theoretical knowledge is very important as your practical knowledge. Your material science is very important, more than buying a scanner or buying expensive photograph. I mean, you can take very good pictures with mobile phones these days. It's not very difficult. Yes. But you don't take pictures patient lying on the dental chair. Even when so many people I've seen, they are taking pictures when the patient is lying on the dental chair. Extraoral pictures, but that's not how you take it, right? So even if you have the best instrument, if you don't know how to take a picture, you can't really use it. So unless you know what a good impression is, a scanner is not much of use, I feel. So that's what it is. I mean, it should be very thorough with your skills before you can start investing more money into, it's like a well. You keep putting money into it, it will never get full. There's always something new that is there to make it a little empty. And then you get demotivated. So
I absolutely agree with what you've said. I think viewers watching this will for sure agree and will consider this. So
I hope so.
I move to my next question, which says, as per you, like since we know aesthetic dentistry is the hot thing, and should a young dentist prefer this as a niche? Why should one focus on this section of dentistry?
I think nobody should focus on aesthetic dentistry as a core specialty. I mean, because unless you are good with composites, you cannot do a good anteriors. Unless you are good with your prosthetic principles, you cannot be good at veneer preparation. Unless you are good with your restorative work, you cannot be good at occlusion. So people think, I want to be a cosmetic dentist. I want to be like, I want to do veneers and it is not easy. I mean, because those procedures are 100% elective. A patient coming to you with pain, you relieve the pain, patient is happy. You are a good dentist. But a patient coming for a cosmetic work is a purely elective procedure. They come to you by listening through somebody or by seeing your page or just landing up into your clinic. To satisfy those kind of patients and to do good work, it is not easy. I mean, it is not absolutely easy. So you need to be very strong with your basic principles again before you can become a cosmetic dentist. I mean, it's not like a cosmetic dentist is just a good general dentist. I mean, you can put it that way.
Yes.
But if you are not a good general dentist, you cannot be a good cosmetic dentist. So you should be good with your work. You should be thorough with your materials. I mean, so many people want to do veneers, but they know nothing about the cements. They will know nothing about the ceramics. They will know nothing about the material they're getting into their hand, what it needs to be looked into, how you need to evaluate what comes into your hand. Just because you know how to pick up a handpiece and prepare a tooth, it doesn't kind of make you a good aesthetic dentist. So aesthetic dentist is just a what do you call it? Can be a additional flower to the plant that you have planted. It cannot be the only flower that grows onto the tree.
I resonate. Same what you've said. I totally agree. I mean, not many dentists these days, they consider that aesthetic dentistry is the only thing they must really vouch for. So very
because
well
that's
answered.
what is shown to them, right? I mean, that's what is shown to everybody. I mean, everybody, if you look at Instagram, if you look at Facebook, if you are just bombarded with those beautiful pictures, right? You are just bombarded with pre and post of a veneer case, and the patient is happy, patient is crying, and that emotions never happen, man. Never happen. I have never seen a patient cry on my dental chair. Never. I mean, I don't know from where do these cases come across. I have done like beautiful work. I've changed life of people, but none of the patients have cried, and they pay for your work. They are paying for what you are providing a service, right? So they pay you, you do a service, expecting that they're going to cry or going to be miraculously happy about it. Doesn't happen. I mean, hardly 1 or 2 patients will be like really thankful about it. So it's not a very, it looks like a very happy feeling, like, but then it's like always patients are right here because they have paid you that much of money. It's an elective procedure. They are getting it done. They want to look good, and they would want their result to last for a very long time. So all these things, I don't think, general dentists should be really worried about doing veneers and stuff. Take time, learn basic stuff, be good at handling materials, and then you can, of course, build on to cosmetic dentistry, of course.
Yes, amazing. I mean, the people, the young dentists, they feel like they are left out. If they don't do aesthetic and cosmetic, they are really left out. So I think
that's because it's like a child, right? It's like a child. You are bombarding a child these days with YouTube games, these mobile phone games. The moment you take out the mobile phone, the child starts to cry. It's similar, right? So we see those cases, and the moment you're not able to do those kind of cases, you just feel very demotivated.
Yeah.
But I mean, aesthetic dentistry is just a very tiny aspect of dentistry. You can do so much to kind of, I mean, for me, if I cement 10 veneers or I cement 1 single crown, the feeling of happiness is the same if the fit is good, if the shade is good, if the patient is happy. For me, the feeling is same. I mean, of course, I might be making more money. I don't make more money because I am salaried and I work for a company. But I'm just saying that if you're working on a revenue, of course, it will make you more happy because more money is going to come into your pocket. But that satisfaction should be equal when you're cementing a single crown. If you're started neglecting cementing a single crown, it's just 1 crown. What if just put it? Then if you do that, then you are not doing the right thing. That's what I feel.
I really liked your approach. I must really seriously. Great.
Thank you.
Okay. So
I know you will say that.
In short, after post-graduation, what do you advocate? Either practice or academics? What do you suggest?
I'll say whatever you like to do. I mean, I'm not an academician that way. So I'm not into research. I was very poor in writing papers. My guide was like, still today, if I talk to her, she'll be like, did you write that article? I'm like, no. So, I mean, some people have that knack of writing articles. They like research. They like reading stuff. And when I read an article, I'll be very honest. I read the introduction, I read the discussion, and I read the conclusion. I don't care what is written in between, though I should. And I'm not saying you should leave that, but it's just that the kind of person you are. I would like to finish an article in 5 minutes, get the important point out of it, and I'm done. Because I'm not in a college. I'm not teaching PGs. I'm not teaching UGs. I don't need that information. It depends on what you like. If you like teaching, if you like that profession, of course, why not? You can teach. If you like clinical work, you want to be a clinician, why not? I mean, do whatever you like. That way, choose the branch that you like, not what your father is telling you or what your mother is telling you, what your friends are telling you. If you like oral medicine, do it. I mean, you will only succeed in something what you like. If you do something with somebody else's decision, it's going to be an ultimate disaster.
Right.
I mean, I could have been a very good doctor. My father was like, I was getting MBBS in the first attempt. It was my BDS was my choice. So I took dentistry out of my choice. So it was not because I got, I think, 93 rank in Manipal or something. And like many seats were empty of MBBS when my father went for counseling. So when he actually went for counseling, he was calling me from there, Ritul, still seats are there, MBBS. Are you sure you want BDS? I'm like, yes, I want BDS. I want BDS. And then I got very frustrated. I told my mom to just tell him to, not call me again and then do the payment for the BDS. So BDS was my choice of profession, and Prostho was my choice of branch. So it's always, I've done what I like, of course, because I have to live it at the end of the day. So that's what it is.
Okay. So somebody has rightly said dentist is an artist. So we know you are a true artist beside dentistry as well. We have recently seen and we've seen and we've heard you playing piano. So I must really confess that it was awesome. How does that help you in enjoying life? And what is the best part of being a music lover and music player?
I'm a music lover. Of course, my car journeys are very smooth. So I love driving because I love music. So I like to play a loud music when I'm driving. The music helps me that way. I play music when I work. So that kind of eases my work as well. And piano is a hobby. I've never learned music. I don't know how to read music. I don't know how to write music. I just listen to a song and I can play it. Wow. So it's more of a learned skill, and it's mainly Hindi songs again. But yeah, I've been, my parents have been quite supportive in buying me those gadgets when I was young. And so yeah, now I have this piano which has been there with me for 10 years now. I bought this in Chennai and then it came to Dubai with me. So yes, that it just helps me out some to play it. Like after talking to you, probably I'm going to play it for some time today.
Oh, wow.
Because time for my new reel is there.
Oh, wow. We'll really look forward to that reel.
Yes.
My next question, what is work-life balance? How important is it in dentist life? Like, we know you are a dentist you've been a dentist in India, Dubai, you're a lecturer, you conduct courses, you are an examiner, mentor, speaker, so many things. And then you manage your social media, and then you enjoy your life. How do you manage all these things?
And you need to take out time for what you like. Eventually there are 24 hours for everyone. I could devote my time more into exercise. Of course I should, I don't. But then everybody needs to prioritize what they want to do. I like to spend some time creating my cases. I mean, a few days are there when Gayatri is not at home. So I do most of the work on that day. So I mean, like today, she's at work, I'm home. So if I have to prepare a case, if I have to do some, time pass, I will do it today. Okay. Right. So, and then you need to learn skills. I mean, it's all about learning skills. When I have time, I start learning photo editing skills. Sometimes I will start learning video editing. I mean, it just takes 5 minutes, YouTube videos, small ones, you kind of watch and learn new stuff. So that's what it is. Sometimes I start reading about investing money. I mean, even because I feel in dentistry, it should be really taught, which is like not taught to anybody. That should be a main subject in undergraduate and postgraduate degrees, but we have not been taught anything about it. I mean, as a dentist, I don't know where to put in my money. So, I mean, there are skills to learn. There is always time to do stuff what you like to do. And yes, so my day is a typical day. Get up in the morning, eat my breakfast if at all I have to eat it. I don't like eating breakfast. And then go to work, have my lunch, come back, spend some time, watch some TV.
Okay, so shall we move on?
Then that's what it is. Yes, please.
Okay, so we've come to the last section. These are one-liner answers for the following questions. My three or four following questions are: what do you say about having a team? How important it is in dentistry to have a team?
It is very important to have a good team, especially a good assistant. So if you have not trained your assistant well, you're missing a lot on a good dentistry. So my assistant now, she knows what I need. So if I'm doing a composite, my materials all are ready. My bonding agent is ready with her. As soon as I dry my tooth, she dips the brush in the bonding agent, it's handed to me in my hand. Wow. So that way the training needs to happen. When I'm doing my veneer cementation, I need her to be proactive. If she's not proactive, then things are not going to be smooth. So the brushes, the bonding agent, everything she has, the light cure she has, suction she has. Whereas I'm handling the veneers on this side where I have to dry them, put the agent, put the cement, and so much other work needs to be done. When I bond my cements, when I bond and cure it, she's holding my veneers. She knows how to hold it. She knows how to cure it. There are so many things. As a team, you need to have a good assistant. You need to have good specialists working along with you. I don't have that privilege as of now. So I send my cases to different hospitals. But if I had a team like a periodontist working along with me in the same practice, a surgeon working, it would have been a little easy. I mean, if I have to do a gingivoplasty, I do it on my own. But if a periodontist would have been there, I would have definitely told, just do it for me. I'll do what I'm good at. So that ways, I mean, team is important. That one line is over, I think, long time back.
No, that's fine. That's for what we called you for, and
yeah.
We love hearing from you. What is success to you?
I think success is again very subjective. What success might mean to me, much less might be good for somebody else. It's like we are all climbing ladders, right? We are all climbing different ladders. We just need to see that we are sticking to the right ladder. If you're climbing a long ladder, even if you reach the topmost success point, eventually you will realize you have climbed the wrong ladder. You have to stick to the right ladder, and success is whatever comes to you. I mean, for me, I am successful that ways, but I might improve a lot on what I am doing. I might succeed much more in life. I might fall down. I might have a bad day in my life. So it all depends. I mean, success is very subjective. You might be very happy in what you are doing. I might not be very happy in what I am doing even at this stage. So it depends. But you should just sleep with peace. I mean, if you're able to sleep well at night, I think you have done well.
Well, how important is money in life? At least in life of a dentist.
Money is definitely very important. I'm not the person who will say money is not important, but then money shouldn't come the wrong way. You should not do unethical practice. You should not do work that you are not confident in just because you're going to make some money out of it. Of course, money is important to live. You need money to buy food, money to buy your equipment, money to buy loops, money to buy microscope, money to buy scanners, OBG. There's so much stuff, investment that goes into your clinic itself. If you are opening your own clinic, leave apart anything else. So of course, money is important, but then you should work for something you like, not for the money. Eventually it comes, but sometimes we have to find ways to make money. So, I mean, you need to have some second source of income. You need to have some money coming in from somewhere else. If you keep dentistry only as your source of income, then it's a problem. You should know how to grow your money. So read about investments, read about stuff, listen to people who are good at it. You know, it's not like you have to be like really pro every day. You get up in the morning and start trading. You know, I was just talking to my brother only. So he was like, I mean, I learn a lot from my brother that way in terms of investing. He's a banker. So he kind of tells me a little bit on how to do it. Again, I can't do the way he says, but still something is better than nothing, right?
Yeah.
If you have 100 rupees lying in your account, 1 year later, it will still be 100. But if you have invested that 100 rupees into even simple mutual fund, it might become 150, right? That 50 is just free. So that way, I mean, it's not like I'm not expecting you to start, people get frustrated because of that. And then they can't really, just don't let frustration creep in.
Okay. How do you take failures in life?
To be honest, again, it is difficult to take failures. Of course, it's not an easy task to take failures. I have gone to interviews where I've not been, addressed to. I've gone to clinics in between 1 or 2 times where even with my skills and degrees and everything, you don't get the job for whatever the reason. You might be overqualified for that job. You might be underqualified for that. I'm just saying but I mean, it might just be a bad day in your life. So you have to just forget it. I mean, you cannot dwell in your past. You don't know what's going to happen in future. So if you are happy with wherever you are, you just work hard to be where you want to be. That's all. And failures are automatic. There's going to be a failure. Whether there's a failed case, I have had root canals that have failed immediately. I have root canals that have failed after 2 years. I have veneer coming out. It happens with everybody. I mean, you can't feel bad about it, right? So you work hard, and that's all. You improve daily.
Okay. Few doctors, they say dentistry is oversaturated. What do you have to say about this?
I agree to that fact. It is oversaturated. I feel there are a lot more dentists than it's a supply demand thing. The supply is huge. Demand is there. But then the demand is not, the demand that is there doesn't know what a dentist is doing. So they want things to be done at a very cheap price. Then the competition comes in. I do for 100, you do it for 10. I mean, patients don't understand that what they're getting in 10 is not what they will get in 100. So that's of course is there, and that is what causes frustration in everybody. Where you are here, whether you are in America, whether you are in UK, I have friends everywhere, and everybody has got their own set of problems. It's not like if you go to US, your life is going to be like a fairy tale, or if you come to UAE, your life is going to be a fairy tale. It's not like that. Everywhere there are struggles, and we learn to kind of row through it. That's all.
Okay. And a statement to justify dentists are fun-loving people to be with. Justify this.
I can't justify that. I don't think a lot of dentists are fun-loving people to be with. I mean, there are better people out there.
Okay.
I mean, yes. I mean, of course, if you find a fun-loving dentist, why not? I mean, but there are people who sulk, always sulk. So yeah, their life is like that.
Okay. So the viewers.
I don't think you got bored in this 45 minutes. I'm pretty sure I kept you quite entertained that way.
Seriously, yes, you are the one, I must say. Okay. So viewers and guys, looking this interview, guys, just stay connected with Dr. Ritul Agarwal as we share the link of his Instagram and other social media profiles in the description of this video. If you are not following him, I must really say that you're missing a good amount of motivation and inspiration in life. So, Doc, we've come to the end of this interview. I will ask you, so can we have your views on our mission at Wise Dentist, wherein we are aiming to motivate, inspire, and de-stress the dentists across the globe? Your views.
I mean, I think it's a pretty good platform that ways. I mean, you will have to like really do good marketing for yourself for sure. I'm pretty sure it will take a lot of effort. Don't leave it in between I mean, that you have started it. It's quite frustrating in the beginning. I will totally suggest you that. So you might not be able to get, but it's a fantastic platform to have dentists coming across, telling their views and giving them their experiences of successes and failures, of course. And yeah, I mean, keep up the good work, man. You are doing good job.
Thank you. I must really thank you because people like you, they keep us pumped up. And it was an awesome having you on Wise Dentist. We look forward meeting you again, maybe with some other topic.
Awesome.